Hi, everyone. Lauren here with our second spinoff from our podcast, Energy Works, Cool People, Big Ideas. And I'm really excited for the cool people that I'm going to get to talk to today. I have been studying with Donna Eden and David Feinstein for, 25 years now, something like that, a long time. And meeting them and getting to study with them and go through their certification program has been one of the most powerful, life-affirming things that I've ever done. I love these two people. I consider them kind of quasi-godparents. And I think that there are thousands of people around the world that think of Donna and David as their fairy godmother and fairy godfather, because they are just so generous with their time, with their knowledge, with their information, and so completely passionate about what they do in their life. Their life really is their work, which is sharing energy medicine and energy psychology with the world. So I brought them on Cool People, Big Ideas to talk about the big ideas and their new book. I'm holding it up right here. It's called Tapping. And the subtitle is Self-Healing with the Transformative Power of Energy Psychology by David Feinstein and Donna Eden. And we are going to talk about all things tapping, from just what it is, where it started, how they both got into it, and why you should care. Why do you want to know about this little technique that is literally tapping on 12 different points on the body, saying these phrases, and why? Why are we doing this? What is this about? What does it do to help you? I guarantee you're going to be blown away by our conversation. It was so fun to do. And this is a protocol that I've been doing for years that helped me through some of the darkest, most difficult phases of my life, and helped to infuse me back again with joy and goodness when I was ready to come back into the world after healing. So much of that healing and that reemerging came through the work of Donna and David, and I couldn't be more excited to share their knowledge and information with you. Here are two of my favorite cool people with some of the awesomest big ideas. Can't wait for you to hear it. Welcome, Donna. Welcome, David. It's such a pleasure to have you on our podcast to talk about energy.
Oh, Lauren, it is a pleasure for us. We're so happy to see you and so happy to be on your program.
Aw, yay. I love this already. I hope you all can feel the energy coming through, because it's already strong. And having the chance to talk to Donna and David is just remarkable. And even more so because I'm going to get to talk to them today about their new book. I'm going to show it to you right here. It's called Tapping. It's beautiful, by the way. And I kind of want to dive in because there's so much here, and I really want to learn from you two. And I want to start. There's this beautiful paragraph that you have on page 20. So it doesn't even start the whole book, but for me, it felt like the start. With writing the book, we are envisioning still ahead of us. So you haven't even, you're in draft form, and we get to come into the draft form with you here. We pause, eyes meet, hands join, and hearts open as we enter deeply into our intention that our highest wisdom may emerge to create a resource that calls to your highest wisdom and potentials. I don't think I've ever seen that in a book before. And it was so beautiful. It really, I had to stop, pause, pull back. I felt with you in a way that I don't generally feel with an author, even when I'm with their voice. It was so beautiful. I love that you included that in there.
Oh, thank you. Thank you. That's exactly how we felt. Where was that? Yes.
Yeah, and I love that we really were drawn into you hadn't written the book yet. And so we get to be in the book, but with you before you had written it. So it was quite remarkable. That one little paragraph is just quite
Well,
remarkable.
thank you. That we were really setting an intention, and it's an advantage of writing a book with somebody you live with.
And
Yes.
love.
Yeah, and
I love that. So since I've gotten the book, I have been doing some form of the protocol every day. I have been doing all kinds of tapping, and so I'm excited by it. I'm excited by these ideas and how you've put them together and all of these concepts. And there's some things really specific that I want to get into a little bit later. But David, this is kind of a question for you. Although both of you have written this book and both of you wrote this book together with Gary Craig, who is the kind of progenitor of this technique. And so I'm curious, what propelled you to revisit this potent topic? What did you feel like you didn't get to say when you wrote before that you really wanted to bring out now? Like, why now? Why this book? Why now? Can you talk us through that?
well, the first book was written in 2003, 2004, was published in 2005. And at the time, we felt that there was almost no research we were aware of in this. And the publisher wanted to call it the power of energy psychology. And I wouldn't let that because it wasn't established yet. It was the promise. So that's what we called it, was the promise of energy psychology. Then fast forward almost 20 years, and we've gone from just a handful of weak clinical trials to approximately 200 clinical trials published in peer-reviewed English language journals and another 100 in non-English language journals. And almost all of them show a significant change from before treatment till after treatment on at least one targeted symptom. So we have evidence. So that is one thing, is we wanted to write from that base of confidence. I had a lot of confidence in the method already based on my experiences, based on training people, based on seeing what other people are doing, but we didn't have the research backing that psychologists such as myself care about. So that was one thing. A second thing is that in those 200 studies, we've learned a lot about how it works. So we can talk much more persuasively and intelligently about how it is that something so strange as this tapping on points on the skin while saying these phrases and doing these incantations with your eyes and humming and counting, how does that really bring about psychological change? We have some good ideas about that. But also what happened in those 2 decades is that 100 books appeared on energy psychology, EFT, emotional freedom techniques, TFT, which is the mothership of it all, and thought field therapy. And so those 100 plus books were out there, and we wanted to write something that no one else had said before about a topic everybody was talking about. So in addition to integrating the research, in addition to really looking at the mechanisms, we decided to take each of the topics that we covered, which were the main reasons people seek help, people go to therapy. So we took topics like PTSD and anxiety and depression and addictions, and we not only showed how to use tapping with them, we looked at, it was like, writing this book was like writing a dozen master's theses, where I had to really look at what are psychologists doing today to treat this condition. What are the best practices that psychology has to offer? Then we can present that, which is useful in itself, and show how tapping goes into those best practices. So each book not only is about the best practices, not only about tapping, but how the two can be combined. And then But wait, there's more. And that is that one of the challenges that our publisher gave us, sounds true, and you know very well, having done 2 books, I believe, with them, is that they were looking at, well, who should the target audience be? And the target audience should be the general public. It should be accessible for everybody. But there's so much that they wanted us to say that would be useful for clinicians, for people that are really experienced with tapping. So how can we write to both groups? And the way that we did that was each chapter starts with the kind of everyday version of the issue. Like rather than starting the addictions chapter with addictions, we started it with habits. Rather than starting the depression chapter with chronic depression, we started it with sadness. Anxiety and PTSD, we started it with worry. So you start out with these everyday, everybody's familiar with these, everybody deals with these issues. And here are some very simple techniques you can use to start with. So we have these tapping scripts where it just gives a script that you tap along with, and you use the words in the script. And that will work for some people. But if the issue is a little more complex, if you have some, history that gets in the way of overcoming this issue, we have the 3rd chapter of the book is called the detective work. So by the time that you get to the chapters on addictions and depression, etc., you learned about how to do detective work so that the technique becomes more and more specifically attuned to who you are, your history, your style. So then if you're needing to take it further than the script, you've got some tools, and then you've got examples in the book of how to take it further. But then we don't stop there, because when you get from habits to addictions, well, that's a whole different clinical entity. So we tell people, if you are dealing with a serious addiction that's really getting in the way of your life, you need someone to be supporting you. Do this with a therapist or a tapping practitioner or somebody that can make a difference. But while you're doing that, here are some of the things you can do on your own to make that therapy happen faster. Here are some things that the therapist, if you don't have to go to a tapping therapist, but if the therapist is interested in tapping, they can read that section of the book to see how to apply tapping to treating a client that has an addiction. So we do that with each of the chapters to go along that trajectory. So those are the 4 different differences between the 2005 book and the current book.
That's beautiful. I love that. Makes a lot of sense. I love that it's grounded in science. I know that that's your bailiwick, and it's one of mine as well. I like to really understand the science behind things. And so I really appreciate that. And I've got some other questions, but this just came up. And so I'm just going to ask you, it's kind of personal. You don't have to answer if you don't want, but do you tap yourself, David?
It makes me nervous that you asked that. What am I going to reveal about myself? But calming down. Yes, I do.
And when did you start tapping? Like, how did you get into tapping in the first place? Did you meet Gary Craig? Did you it's a very strange thing. You are a like Johns Hopkins trained, like as kind of metal. Maybe our audience doesn't understand that, but is by the book as it comes. And now here, all of a sudden, you're doing this thing that for years people are like, what? So what drew you to it? How did you get there in the first place?
A great question. The first barrier was embracing energy medicine, which I learned of long before I learned of energy psychology. And I had my first career job was at Johns Hopkins, as you mentioned, the Department of psychiatry, which is part of the medical school. And so that I was there for 7 years in Baltimore, and then moved to San Diego, where I meet this girl 47 years ago this week. And she's talking about energy. And I'm not talking the same language with the same word. I mean, energy has some very known properties. It has frequencies, it has wavelengths, and it is the capacity to do work. She's talking about something that has memory, that has intelligence, that can heal you in ways that made no sense to me, and so I thought, well, there's other things I like about her, and we'll just kind of put that aside. And so you can imagine the discussions, though. So, but what happened was that when I was at Hopkins, I was there for about 2 weeks when the chair of the department calls me in. So I'm summoned to his office. Now, this is my boss's 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 boss. And I'm thinking, oh God, how did I screw up this bad, this fast to get this kind of a reprimand? But when I walked in, he said, and I just come there from California, and he said, what are all these new therapies coming out of California? Is this old wine and new skins? Is this more California fluff? Or are there real innovations we need to know about here at Hopkins? You're from California, go find out. And so I had a year, I had all my regular duties and teaching and research, but I had a year, and there were more than 200 new therapies at the time. And I looked at 46 of them, transactional analysis, primal screen, Gestalt therapy, things you don't hear them in the limelight anymore. They still exist in certain circles, but they've kind of fallen away, and largely because the best of them have been embraced by conventional therapy. But in that process, I learned how to ask really hard questions. I'd call these people up on the phone before internet, and I tell them we're doing a study here at Hopkins. We're very interested in the approach you've developed, and they would be very generous. They'd send me their papers. They'd spend all the time I wanted with them on the phone. They'd invite me as their guest to their workshops. And I went to a lot of them. And so for a year, that was what I developed. So then I come to San Diego and meet this girl, and we start to have a relationship, and she's got this practice, and I'm not sure what she does, but I think, okay. And then I noticed that people are really singing her praises. They're saying that she's really helped them, and people are coming from all over the world, and they're coming with serious disorders, and they're getting help. And so that kind of opened me a bit to it. And then after, I think, for a few years, she started to get enough attention that people were asking her to write a book. And she really didn't, she felt like, well, how can, it's so organic, it's so intuitive. How do you put this into a book? But I was very left-brained to a fault. And so I started interviewing her, asking her the same kinds of questions I asked the people at Hopkins. Well, she could not be tripped up. Every question I asked, and I asked tough ones, she had a reasonable answer. And what I came to realize is that as intuitive and happy as she seems, she is very empirical. Empirical means it's based on observation, experimentation, observation, experimentation, observation, experimentation. And while I couldn't replicate her observations, because she sees energy, I don't see energy. But what would happen is someone would come in and lie on her table, and she'd look at them, and she'd see where the energy was blocked or out of harmony, and say, our meridian, or say the kidney meridian are blocked. So she would do something simple, just smooth over it in the direction it's supposed to flow. Did that work? No. So observation, experiment. Okay, look again. Okay, well, it might be that this meridian up here that feeds kidney is where the problem is. Is that blocked? So fix that. That fix it? No. Usually it'll fix it the first or second time, but then she might say, oh, okay, the chakra that feeds that meridian and supports her, that is really out of balance. So she'll fix that. And then she'll look and say, oh, okay, now it's flowing. So that's the empiricalness of Donna. So I became a believer in her work. I became an advocate. I helped her write the book, and we started doing workshops. But the story goes on a little longer now. If you want me to get into how I got into energy psychology, or do you want to add anything to this?
You're going fine.
Keep going. Okay. So we've been together at that point for 20 years or so, and we're very we're starting to really integrate our work together a little bit. And I still had my practice as a clinical psychologist, and I was leading a supervision group of other therapists. And one of them came in one day, and she had been studying this tapping stuff. And she starts talking about it enthusiastically to the group. And I'm listening and going, oh, come on, this is crazy. It's like, what? I didn't learn anything like this in graduate school. I didn't even learn anything like this in the studies I did of the integrative psychotherapies. What is going on here? And so I do what psychologists do. I go and look up the research. There is none, not one clinical trial. And so I formed my opinion about tapping very strongly. And I didn't, lay it on her. I was polite, but I kind of steered her away from talking about it in my supervision group. So as you know, when you form a really strong judgment, it often comes back to bite you. So here I am talking to you as an advocate for this approach. So
did you go back and apologize to her years later, or thank her?
I have not been able to find her, but I will certainly, if I do, I will certainly give her a copy of the book with my sincere apologies.
Well, I imagine that she is out there talking about. He's out there talking about this, but let me tell you about what he was like in the beginning when I tried to bring it to him.
She'll probably sign up at a book sign, show up at a book sign. But when this was all about when we were finishing the book, and it came out in 1999, and we went on the road, and the publisher put us on a 6-city tour, as publishers used to do then. And
we thought we were going to go back to life as normal after those 6 cities.
But we kept getting more and more invitations. So in a way, we're still on that 6-city tour, after more than 1,000 appearances.
And 26 years.
Yeah. But about 15% of the people that come to Donna's classes are psychotherapists, because they know that if they can really work with the energies that are involved with depression or anxiety, that gives them a heads up with the talk therapy. And so a weekend workshop on energy medicine, and one of the participants was a psychologist, and that workshop ended at lunchtime, and she says to me, I'm part of a group of colleagues who meet every one Sunday night a month, and it's tonight, and what they're doing is they are going to be demonstrating this tapping therapy that's getting a lot of attention. Would you like to come as my guest? And so I say, okay, this is where I got to take it seriously. If psychologists are actually making it a topic in their meeting, there must be something worth looking at. So I show up with my Skeptic's hat on, and there was at somebody's house, and there was about a dozen psychologists. And the way the evening was set up is that one of them, who had been studying thought field therapy, actually, was wanting to demonstrate it to the group. So he invited his colleagues there to, in advance, to propose a client who they were having difficulty with and let him do a demonstration on that client. So we all are in this living room, and the therapist that's doing the demonstration and the client are in the middle, facing each other in chairs, and the rest of us are around it in this living room. And the woman has had a severe fear of closed spaces. She's very claustrophobic. And so I'm watching and I'm saying, okay, how's he going to introduce this strange method? But he did it in a very, I thought, logical, sensible way. He starts asking her about her symptoms and where they started. And he asked her about what she's done to try to overcome them. And she's done various self-help approaches. And this is her second round of therapy, and it's just nothing to work. And so I'm okay, well, that's good. That's good counseling. And then he asks her to imagine being in an elevator, which was one of the situations that she found hard. And so she imagines being in an elevator, and then he asks her to give a rating of 0 to 10 of how much distress it causes in her mind or body right then. And I'm familiar with that because that's used in a number of therapies, including systematic desensitization, which I was using. And so I'm going, okay, this guy's pretty straight. He's kind of, this is good. But then he starts doing these strange things. He has her capping. He has her cap on herself while he models it. And then while she's capping, he has her saying these words. And the words were fear of elevators, 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 fear of elevators. I'm thinking, oh my God, he's just giving her post-hypnotic suggestions to make her symptoms worse. And this is horrible. This is malpractice. Do I have to report him to the ethics committee? This is just horrible. But after about 2 minutes of it, he has her imagine herself in an elevator again, and it's gone down to a 7. And we're, well, what's that about? Surprise, I thought we'd go up. But then they do another round of tapping, another 2 minutes or so, and it's down to a 5. And I'm thinking, wow, what's going on? Oh, okay, I got it. This is some version of the Stockholm effect, where she's developed an affection for him, and she doesn't want to embarrass him in front of his colleagues, so she's just playing along. So then another round, and it's back up to a 7. And I'm going, oh, okay, I knew it wouldn't work. These are just normal fluctuations that you get when you're doing it in front of a crowd. But he said to her, when it went from a 5 to a 7, what was going on in your mind? And she says, I had a memory I haven't had in decades. I was maybe about 8, and I was playing with my brothers, my 2 older brothers and some of their friends, and we had this big appliance carton, like where you'd have a refrigerator might come in. And one of us would get in it, and the rest of us would push it. And it was great fun. And then it was my turn. They pushed it up against a wall so that the only flaps that opened were against the wall. And then they left with some teasing remarks, and she was left there in the complete darkness and not weighing enough to be able to get herself out of it. And she starts screaming and screaming and screaming and screaming, and she's telling it. She's getting more and more, and she's clearly at a 10. And I'm thinking, oh my gosh, okay, well, this was useful. Now the therapist that is treating her every week is going to be able to do some talk therapy with her. And after about 6 months, it's going to resolve her phobia and other related issues. But the therapist didn't stop there. He just engages her as she's really upset and starts having her tap. And he doesn't even give her any words at first, because you don't need the images of memory or words to get the amygdala aroused. You know, that just imagining a situation, and you could see that her limbic system was in a threat response. So she's just tapping, and then very quickly, it comes down. She's getting calmer and calmer. And then he starts to add words like, it was a long time ago. I'm safe now. And it just comes down to zero very quickly. And then he starts to look at other aspects of it. And he has her work on her resentment towards her brother, on the sense of betrayal that they did this to her, and caps that all the way down to zero. And then caps on the loss that she's had all these years, that she's had this phobia and all the things, ways it's restricted to her life, taps that down. So every aspect that he or she can think of, they work on it. Because she can do around her capping in 2 minutes, you can work with a lot of issues very quickly. So then we go back to the elevator. And now, without having focused on the elevators, it's gone from a 7 down to a 3. And then very quickly it gets down to a 0. And so here they are in the middle of the room, and she just said it's a 0. And everybody's watching, and psychologists like to test things. So if somebody says, well, there's a closet there, in someone's house, it's a coat closet there. It's where she does what she gets in the coat closet. And so she agrees. The therapist is absolutely sensitive. He says to her, okay, you're not trying to prove anything to anyone. We don't want to re-traumatize you. If you get a little bit anxious at all, you just open that door and step out. And she agrees, steps in, and then half a minute goes past, and a minute goes past, and it's a long time just staring at a closet door. You can imagine a dozen psychologists hovering around this closet door and staring. And then 2 minutes, and it seemed to me after about 3 minutes, the therapist knocks and says, "Are you okay?" And she opens the door, and she's exuberant. She is not afraid of being in a closet, in a small little coat closet. And she's just knows that she's healed. She knows it. And everybody is congratulating her and congratulating the therapist, except me. Okay, I got it. I know what this is. This is a social psychology experiment to show how gullible psychologists can be. This is probably somebody's master's thesis. So, but it turns out that that was the turning point for me. And I got the training, and I've had some version of that happen many, 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 many times. It's not always a one session cure, but surprisingly often it is. With something like a phobia, with something like PTSD or chronic depression or a tremendous loss or an addiction, it's many sessions. You multiply what I just said by 12 maybe, and you can chip away at it so that after just the first session, though, the person knows that something is working. They know that they're already feeling somewhat better, so they have the faith to come back until they really resolve what it is that they're working with.
Wow. Yeah, that's just remarkable. And I love that. I mean, because you are considered now one of the pioneers of this technique, and you've done so much work. And now this is your second book on this, and you're really at the forefront. So I love to hear the backstory when you were the biggest skeptic. And of course, Donna, you talk about this all the time. You love skeptics. Clearly you love skeptics. You married your biggest skeptic, and you were able to convert him into probably your biggest supporter. I want to turn to you for a second, Donna. So I don't think we won't go through the points now, but I do have some questions about the phrases that we'll get to. But what I found so interesting, because you can find these points. They're different a little bit in this book, and we'll talk about that. But you can find these points. They're 12 points. I've written about them. I've actually included them in all 3 of my books because I find this work to be, just like you said, sort of this miraculous, powerful, why does it work, but it does kind of thing. And I've had tremendous results myself with it, overcoming trauma and different things like that. So at the beginning of the book, you each talk about what brought you to this work. And Donna, I found this so fascinating. You write about your own experience with the tapping, that you say it's profoundly calming, energizing, helping you to get past difficulties. But what I'd like you to talk about, you write here, I usually experience energy as a flow or a spiral, but tapping created a pulsing.
I want to unpack that, because when we talk with energy medicine and Eden energy medicine, we often use that word pulsing, thumping, pulsing, the pulse of every system in the body. But for some reason, you chose that word, that was different with this tapping and how you usually experience energy. And you go on and you say, what was new was how the pulses going up to my brain were affecting my thoughts and emotions. My entire body was connected in an energetic flow with my consciousness. Can you talk a little bit about what you mean with that, and what you experienced different? Because it sounds like your experience was different than what you had experienced in all of the work that you had done for years.
Wow, yeah, it's a very good question that nobody has ever asked me before. So see, well, when I see a tapping, like a tapping there, um, I first see some like an opening, like a spark, like something like that, and then it begins to pulse up the meridian lines all the way up to the brain. And sometimes, if somebody is pulsing for a long time, it'll absolutely sync with their heartbeat. And that is an amazing thing. And it's so rhythmic. I see far beyond all the brilliant scientific stuff that David sees and can talk about. But I think it really does help with the rhythm, that people find their own rhythm again in a new way. And maybe they've left it a long time ago. But boy, in the tapping, something happens all over their body that gets in sync. And that's, yeah.
One, good.
No, it's not so important, but I also see colors. I see colors in the tapping. Sometimes it's changing constantly, or sometimes it's just one color constantly pulsing up to the brain. And sometimes I see the colors go out from the body as if it pushes the aura out further. So it does so much more than what is obvious, and the thing that they're trying to work with. It's helping their health, their vitality, their consciousness.
I want to piggyback on that, because so much of your work is to do with issues in the physical body. And I know we work with emotions and as well, and Eden energy medicine, but so much of it is physical. And this work is very mental and emotional. And this is just my brain curious. Do you see, like, when you see the tapping and you see it going up into the brain, do you see a different, like, colors or something that you see happening to the mental body? Is it in the brain, or is it you see their mental body shifting throughout their physical body?
Well, yes, you have the vagus nerve that goes up the neck and into the brain. And so when things go up the brain, you also immediately see a rush in the body, because that vagus nerve connects to every organ in the whole body. And so it just turns everything alive. That's why it becomes a part of a more basic rhythm in them that they might not have been in for a while. And so and up at the head, when it is at the head, it all depends on just how bad something is that somebody is working through. Like PTSD, you can see it become thick and smoky before, and just like that's why it can take longer than once sometimes, depending on what somebody has. But it gets very thick and murky and smoky, and then you can start seeing a clearing, and it's quite amazing. And the clearing goes all over the body. I've seen people who, well, in the very beginning, I just remember I was concerned that I wonder what this was going to do. We were in a class, and I could see that this person had some heart problems. What it did was it made her heart get more in sync with all of the energies in the body. So it was really good for her heart. We didn't talk about that at all.
Wow. Fascinating.
Now, one more thing is that I learned 40 some years ago about tapping used differently. And it was for physical things. And they say that a couple of thousand years ago, the dentists of the day use tapping to take away the pain that were in the teeth. And so tapping's been around, and it's just that it's been refound in these magnificent ways.
Is that you teach the zone tapping? And is that what you're talking about? Like you tap at the wrist or the ankles for the pain?
Yeah.
Fascinating. It's so it so that technique, the zone tapping, I think came from ancient Chinese medicine, if I'm okay. So, but this didn't, I mean, it's working with meridian points, but there's no, I mean, we don't know if there were psychiatrists or psychologists back in ancient times. I would imagine people had, phobias and things like that back then, depression. I mean, you didn't kill the beast, so your tribe went hungry, you were depressed that you weren't able to do that. So maybe there were, I wonder if you've thought about that, of like where this, like who thought these 12 points were like, this is it. This is the thing that's gonna, like who came up with that? That's such it's so unique. You can't say so unique. It is unique and it is so strange. And so do either of you have any ideas on that, of where
I'll
this birth?
first, and then David can speak up. But I am assuming that our ancient ancestors did know. I do know that when I first started experimenting with trying to heal myself, 45 years ago or something like that, I did everything. Sometimes I would hold the point, sometimes I would rub it, sometimes I would tap it. It's just a natural thing. What's the difference if you tap it or versus holding it? So I think that it goes back thousands upon thousands of years. And yes, somebody refound it in the 70s, David?
Yes. Roger Callahan was experimenting, was treating a woman who was not responding, and he had her then tap on some point because he was studying applied kinesiology off on the side, and she was nauseous, and the nausea went along with an extreme fear. He had her tap on the stomach points after many sessions where nothing was helping, and it was kind of a last resort. And the tapping immediately took away her nausea, but her nausea was connected with her fear. So her fear went away as well. And she was very quickly symptom-free. And he noticed that. And so he started tapping with his patients, and he then started experimenting with different points. And he came up with what were called algorithms. And algorithms were a set of points that you tap on for a condition, such as for grief, or for fear, or for anxiety, or for depression. And there were different points for each one. And then he had also a more sophisticated ways using energy testing to determine which points are going to be the most effective for a particular person. And it got to be, he only taught it to professionals, and it was a pretty complex system. So Gary Craig, who's not actually a therapist by training, he's a Stanford trained engineer, but he's been interested in self-hypnosis and NLP and those kinds of techniques. So he got into the training, and he looks at it as an engineer and says, there's an easier way to do this. And so he comes up with this one size fits all, where of the hundreds of acupuncture points, he selected a finite number from Roger's methods, and that has evolved a bit over the years. But what I think the key point there is it's one size fits all, that you are tapping enough points that you're getting a meridian system flowing, and it's working also with the words and images and memories that the person has. So that so my opinion is that the exact points don't matter so much. And in fact, different therapists wind up using different sets of points, but there's a certain core that seem to be, that everybody seems to feel are effective. And in our book with Gary Craig, Donna added a couple of points to the EFT points. And so she felt that it's not that these are essential, but by tapping on the large intestine points on the side of the leg. That helps to process some of the emotions. Tapping on the heart chakra is a good place to tap. So I don't think there's a magic to the charts of which points are essential, and there's no research that really compares the different sets of points. Although in traditional Chinese, there's each point has a function.
Yeah, all I was going to say is I think the 12 are really masterful because they all hit a different meridian. And if you get all of the meridians, there's more of a completion. I just think that those are great. And
they hit all the meridians that seem to be involved with emotion.
Yeah.
They don't
Yeah, that makes a lot of sense. My light bulbs are going on as you're saying that. Okay, you said something that I need to circle back to. You said that you're not even sure that those specific points matter, and it's about activating the amygdala where we hold our emotions and all of that. So I want to kind of get into the specifics because maybe you're going to say the same thing about this too, which I would like to know. The specific wording. So you write, you've given many, I'm not even going to call them scripts because somewhere in the book you say you don't want to just give scripts. So I'm not even going to call them scripts. They're just sort of suggestions because I feel, and you wrote this, that the scripts are kind of limiting, right? Because it's just you follow a script, but maybe that's not my issue. So you give sort of a recipe that you could tweak to your own tastes. And most of them and most everything that I've ever learned about this kind of tapping has a very similar, even though I fill in the blank, I completely love and accept myself. Now, those are, again, they're sort of set, but they can be wildly varied. But there's always some of that, even though I love myself, I accept change, whatever your kind of resolution is. So my question is, why the even though? Like, I love and accept myself. All of my foibles, all of my problems, all of my issues, I know them like the back of my hand. I've done tons of work with a lot of different modalities. I love and accept myself, even though there may be things that I want to change. I already love myself. So why do I need to say, even though I'm still afraid of spiders sometimes, or even though I have a little bit of a toothache right now, or like, why do I need to say that if I already love myself with all of the foibles that I already know? Like, even though I have all those things, I still have done the work to fully love and accept myself. So what's going on?
Well, even though is not always essential, it works really well. And here's what it does, is that in the kinds of examples you're talking about, you start out with a symptom. So even though I'm afraid of elevators, I deeply love and accept myself. What you are doing then is you're building in an acceptance of the symptom. As long as you are fighting the symptom, your psyche mobilizes against the fight. When you can accept the symptom, when you can see how the symptom served you at one time, when you can embrace it, then you can begin to change it. As long as you're not accepting it, it's much harder to change it. So that even though what it does is you are pairing the symptom with the acceptance statement, so that when you think about your fear of elevators, immediately what comes in is, I deeply love and accept myself, so that they are merged in your nervous system. And so that is the reason for that. And it's not, certainly what that's called as the setup phrase. That's just, as you know, that's just where it starts. You move on to many statements that don't start with even though, but you always want to do that even though. And there's many ways you can take that, because you can pair it not only with acceptance, but also with what Pat Carrington called the choices statement that's become very popular, which is even though I'm afraid of elevators, I choose to know that this is the time of my life to overcome that fear. So now the symptom is paired with something that's empowering, so that you have, so to answer that question on, even though it is to really pair up the problem with something that's self-acceptance or empowering.
I love that. Thank you. Thank you for explaining that. And so I want to dig a little bit deeper because this is there's a lot in this book. And obviously, it's talking about all of these different options and options within the options. So talk to me about, there's all these phrases, but they don't always have to be even though. And at some point, and I've done some tapping with some professionals. I've seen professional tappers. I don't know if that's not what they call themselves, but professional tappers. I'm just going to say that for now. And done some really crazy matrix. We don't have to go into that, but it's a whole sort of sidebar of this for deep trauma. And the words just, and I've actually done some tapping with you. Now, it's just coming back to me now. We did a whole trauma tapping scenario. I don't know if you recall that. And at some point, very quickly, the even though flies out the window. And then it's just like, I'm like in the elevator. Oh, I'm going up the Eiffel Tower. I'm having such a great time in Paris. I love Paris. Oh, but Paris, one time I got lost in Paris when I was a little girl. I forgot all about that. Now I'm scared again. But wait, I'm happy. So you can but I'm not really sort of making fun. What I'm trying to see is, how can I find my path through without a you to guide me, to know when do I drop the even though, when do I put in the positive affirmation of like, I love myself, I love myself, I love myself, I'm great, I'm great, I'm great, I'm successful. Like, when do I drop that and then just put in, I know I'm saying a million things at once. Can you unpack what I'm saying?
Yes. So, the wording is, I think, is very important, but there's 1,000 right ways to do it. And a really skilled professional tapper, has a lot of experience in how to really pace the wording with the person. So when I'm working with somebody, I'm also really attuning to them at all levels. I'm looking at them, I'm kind of feeling their energy. I'm watching what each tapping instruction does, and that informs me on the next one. But in a very general way, first you do the acceptance statement, and that's the even though part, and then you go into tapping, which doesn't have the even though. And you generally start with what's most troubling, and that might be a body sensation, it might be a fear, it might be guilt, whatever it is. You start there, and then you let it lead you. And a very good metaphor that is used in our EFT, at least, is peeling away the layers of the onion. Because as you tap on say, the fear of elevators, and the fear of elevators goes down a little bit, the fear diminishes, and something else pops up that's related that you didn't have access to. Like with the woman, where what popped up was that ancient memory from when she was 8. But often it'll be a sensation. Let's say, oh, now I'm really feeling a thickness in my chest, or I just can hardly breathe. And they weren't there before, but now that's what you focus on. So you change the focus to whatever comes up. And the way that this is structured is, first you do the acceptance statement, even though then you do what's called the sandwich, which is you go through the 12 tapping points while you're making your statement, then you totally shift to something completely different. Roger Callahan called it the 9 gamut. We call it the integration sequence, because you're working intensely on an issue. Now you're shutting that aside, and you're just activating different parts of the brain. So you count, and then hum, and then count again, or actually hum, count, hum, and you're activating left right brain, left, right brain. So you're getting, it gives the brain a chance to integrate it. Same thing with things you do with your eyes, you're engaging different parts of the brain so that they all can integrate it. This happens very fast, about a minute, and then you're back to the tapping. So that's the sandwich. But at the end of the sandwich, you take another sud rating. And the sud rating really informs the therapist. And self if you're self-guarding, it informs you on where to go next, because you notice, okay, it's going from an 8 down to a 5, but how do I know it's still a 5? Okay, I know it's still a 5 because I'm still thinking about how embarrassed I was when that happened. And I'm also feeling that my breathing is somewhat labored. So, okay, so now we start tapping on that. Now we tap on, and so once you can get most of the symptoms or the difficult feelings down, then you can start to put in more positive. If you put in the positive too early, it's just not going to land as well. There's nothing wrong with it, but it's just not going to land as well. But as you kind of clear the deck, then it's, it's a new canvas. You can really begin to program some very positive responses.
Just another thing, before we end that segment, is that I've seen you when somebody is stuck at a number and they're not going down any further. You will go back to an even though I'm still at a 4 and I'm not going down any further. I deeply love and accept myself. And yeah.
Nice. I like that. And thank you for explaining the 9 gamuts, because I have a question right here. What is going on? So I appreciate that you're activating all of these other parts of your brain. And I guess you feel that an individual, because how you were just talking is like if I'm being guided, but so if I'm doing this by myself, how do you're saying that there's 1,000 right ways. So I'm just going to trust that the words that I'm using, even though I'm not sure if I'm using the right words, I'm going to trust that they're happening, and that if I use them on this point versus the other point, it's all right, and I completely love and accept. Is that what you're kind of saying? That I can't?
Yes, it's a very forgiving system.
Yeah.
It really is. And one of the other things about the book that we'd never done before is we knew that the techniques work. We knew that one-on-one they work. We knew that they work in a group, but we didn't know that if they were going to work with just written instructions for people to guide themselves. So we enlisted a fairly large group of people to test drive the book, the exercises. And what we found from the journal entries that they sent us was that this really does work. It's, yes, there are many issues where it's better to have a guide, somebody with another set of eyes, somebody with training, somebody that takes it, but you can do a tremendous amount with on a self-help basis. And also there is a study of more than 200,000 people who use the Tapping Solution app, and the study showed that there was significant reduction of anxiety, and so there's a lot of reason to be optimistic that people can get a lot of mileage out of doing it on a self-help basis.
I love that. I agree with it, because I have personally had just incredible shifts with this technique. And I love that you put this in here. I want to read this, because you said you had test pilots read this, do the work while you were writing the book, which is just brilliant to do that. And one of your test drivers talked about how difficult, I think it was a man. I don't know why I thought that, but anyway, I'm going to say he, demanding job, limiting time, found it difficult to devote the time that it takes. But then when finally, because he had committed to this with you, so he's like put it in his calendar and he did the work. And he figured out the phrasing, all of the things that we've just been talking about. He really took himself through. And then you write this, which is just, I love this because it's so honest and it's so true. And it helps us as the reader who wants this. And the promise is that it's going to be quick. and it's going to be easy. It's 12 points with a couple phrases, and yet it's not. You've got to kind of do some digging. And so here you tell us right there. Changing lifelong psychological and behavioral patterns that interfere with your well-being and fulfillment requires more than a casual read through a book. So sorry. I mean, right there, you're just like, you're kind of, it's funny. Obviously, it's funny. You're like, sorry, not sorry, but you're also holding us as the reader to say, like, we've got you, but you have to give to us as well. You've got to give yourself to this work in order to receive from it. It's not just, what is promised so often in sort of traditional, or not traditional, excuse me, in Western medicine, where it's like, this thing will cure that. You don't have to do anything. This seems like it, but you have to still, you've got to do some excavation. You've got to do some work. It's not really just going to happen. You've got to put in your time.
Yes, thank you for underlining that, because it's a little sobering when so much of the hype about EFT is how fast it is.
Yeah.
And it's true. It is very fast. And it can help a lot of things very quickly. But when you're dealing with very long-standing, deeply seated emotional issues, you need to respect that.
And I just a couple more questions, and I'll let you guys go. Deep-seated emotional issues. One of the deepest things that I learned going through your school was this connection, or is this connection, that body, mind, spirit is one thing. It's really just energy, but it's one thing. You can't separate the mind does this, but the body does this, and the emotions do this, and the energy does that. It's one thing. It's like a hologram, right? So however you look at it, you're going to see the whole piece, whatever lens you're looking through. And so from my perspective, I'm always interested in the physical gains from a lot of this work, understanding that my psychology can interrupt my physical expressions of growth or healing or all of that. So you talk about sports, peak performance in sports. And I love that chapter because, of course, that's what I want, peak performance and physical things all in my whole life. But you also talked about the cancer a couple of times, this woman who had cancer, and then she comes back up and towards the end of the book. Do you find that this work can be or is equally as powerful healing physical ailments, knowing that everything is connected? But do you find that this work can be just as powerful for physical beyond the emotional and, the other things that are kind of its hallmark?
Well, I think that there is an emotional component to physical illness, even if it's not part of the etiology of the illness, even if it didn't cause the illness. When you have cancer, for instance, there's a lot of emotion to it, and that emotion pulls your energy. And if you can really release that emotion, it releases energy, and it makes a difference. But for something, and as you saw in the book, there have been cases where just the tapping alone has overcome really horrible illnesses. But if I were referring someone with an illness, I'd be more likely to refer them to an energy medicine practitioner, hopefully who knows tapping as well, because Donna's approach works with 9 systems, as you know. Tapping works with 1 system. It works only with the meridian system. And so there's so much more to it. Now, in defense of tapping, it also happens that when you get the meridians all flowing, that impacts the aura, that impacts the chakras.
All 9 energy systems.
Correct. Yeah. But I'd rather have a technician like one of Donna's trainings to work with something like cancer or MS or anything like that, rather than only focus on the emotional components.
I just want to say, recently I made a new friend who came upon healing from a very different aspect than me or anybody else I'd known. And her thing was she worked in a cadaver lab for 5 years. And what changed, they were always supposed to be delicate and just work with each organ at a time. But what happened one day is she just wanted the body to be pulled down a little bit. And she grabbed the foot and pulled it just for down, get it down for an inch or two. And what she saw absolutely stunned her. This body that was dead, but some ligament went all the way up everywhere in the whole body and all the way up into the head. And until that moment, she had no awareness that it isn't, just how it's never just physical. It goes into everything else. And she left that work that day because she knew she had to do a different kind of work and deal with that fact that everything is so connected.
Yeah. Beautiful. That's a beautiful segue to what do you two hope with this book? What is your hope for this book to be out in the world right now?
I'll say it first. I just want people to be empowered to know that they can help themselves, and they can also take somebody else and teach them, and then they can work together, and one can be the guide for the other. I mean, you can get better and better at it, but it changes your life when you have that knowledge that you can be empowered to help yourself.
Yeah, our organizational model is raising the vibration of the planet one person at a time. And I hope the book will do that.
Yes.
But I also hope that it will impact the profession, healing, the mental health profession in particular, because there is a tremendous amount of resistance to these new somatic therapies. And while that is changing, and it's changing in some really good ways, the resistance is still so strong that we are having to fight for any kind of accreditation or recognition. And I just got really creamed by 3 of the world's most prominent psychologists have just taken an article I wrote and really ripped it apart, and very, in my opinion, unfairly, because they were doing it based on evidence that is more than 20 years old. Back when there was no good research, they were ignoring all the subsequent really solid research. So, but old paradigms die hard, and so there's a system in place. It's, our whole culture is sort of still mechanistic, saying, well, it got us to the moon, what more do you want? So bringing energy into the paradigm is still a fight. So I'm hoping that when disaster strikes, that there will be energy psychology teams brought in by the establishment. Right now, they're brought in by people that are really committed to this, and it's actually been effective in more than 30 countries, but it's on a small scale compared to what it could be. So, and I think the same thing in the hospitals. I think if you tapped before a surgery and after a surgery, if the healing would happen faster and the surgery would go better. I think that there's so many applications of this. I'd just love to see this book be one of the cogs in the gears that really bring this much more forward in the world.
I love that. I hope it's more than a cog. And I'm so surprised really to hear how much resistance there still is. Maybe I operate in an echo chamber where I only hear, the energy world, but I'm so surprised by that because I suppose that's not true. A while back, I did some psychotherapy with a Jungian therapist who was very well known, lots of books and all of this. And we never did any somatic work at all. And I honestly I don't value that experience, that it was that helpful or transformative to me. And I work now and have for years with a therapist that does all kinds of energy work. And I know, I mean, the results are just, I mean, clicking through, old traumas. And I hate to say clicking like there's that many, but there are, and just moving through them. And so I'm just surprised that there's that much resistance still. I don't see that so much, but you are deeper in the world, obviously. And I can't imagine a better champion than someone who started in the kind of resistance that you're seeing now, to help move that forward. So I hope they listen to you, both of you.
Thank you. Yeah, I do have a lot of empathy for their skepticism. I really do. But it's also time for them to update their data.
Yeah, there is. Well, this is a way to update that data. And I hope that this goes near and far and really speaks to all of the people that need this work, which is really, I mean, let's be honest, everyone has had some kind of issue in their life that they weren't able to overcome. If you haven't gotten your hands on this book yet, I encourage you to check it out. It is both easy and will hold you for a lifetime, no matter where you are, and give you really valuable advice and help, actual techniques that you can take away to make your life better. Thank you so much, Donna. Thank you so much, David, for writing this book and for sharing all of your wisdom about this incredible topic.
Thank you for having us, Lauren. This is wonderful.
Yeah, thank you,
You asked
Lauren.
great
Yeah.
questions.
Wonderful.
Right.
Thank you.
Okay.